going to be taking you through a slideshow, and then we'll have some opportunities for you and I to share questions and to talk a little more about anything that you might have on your mind. So look, you've got down there a Q&A button. So if you have a question, I need you to put it in that Q&A box. So you can just click on that icon, put your question in, and I'll be really happy then after my presentation to answer those questions. So I'm going to go ahead and get started. I'm going to share my slides and then take you through this program. I'm really excited to have this opportunity. Well, so I see actually, okay, Sajar, hello. So great, we can use the Q&A, and that's helpful. All right, so let me just get my slides up. So hopefully you can see my screen. So I'm going to be specifically talking to you today about our senior leader apprenticeship route with an option to do the MBA. If you're interested, if you're an international student and you want to just do the MBA, the MBA, the Executive MBA, we have other webinars that you can attend. So this one is really focused on the Senior Leader Health Apprenticeship is what we're calling it. And that is a levy-funded apprenticeship funded by the government here in England. So the agenda really, and what I'm going to be going over is, first of all, I'll talk to you a little more about UCL and the Global Business School for Health, where this program's located, and our amazing facility there at UCL East. Then I'll talk more about what apprenticeships are, the Senior Leader Health Apprenticeship that we've designed, why the apprenticeship plus the Executive MBA, how it works, the program structure, then a little more about careers, the fee structure and funding. And then, of course, at the very end, I'll make sure that if you've got any questions that you need to ask, you can have an opportunity to ask them then. So without any further ado, I'm going to go straight into the rest of this presentation. So who are we? So we are the Global Business School for Health. We were established formally in 2021. We took our first class in 2022, and we are the first in the world, a business school for health. We are at, of course, UCL, which is a world-leading research university. According to the latest QS rankings, UCL is 9th in the world. We have maintained that the last several years. The university is got 30 Nobel laureates. We have 11 different faculties. Of course, in the UK, we're ranked 2nd in research power, and I'll talk more about that. We've got 430 undergraduate programs. We've got also 720 postgraduate programs. I believe currently we are the largest student-led body in the UK with 51,000 students from 150 nationalities, and we have around 16,000 employees. So we're a massive university. Our strengths really lie in medical sciences, life sciences, brain sciences, and of course, population sciences. And that's where the Global Business School for Health sits. So it's just an incredible place to learn and study. And some of our really, what makes being a student at UCL so exciting is that disruptive thinking. And that really goes back to our origins in 1826. of course, we're just about to hit our 200th birth anniversary, and from our founding and establishment. So it's a very exciting time to be at UCL. And UCL is, a dynamic university associated with a number of wonderful trusts. The University College Hospital is, of course, one of those trusts. Moorfields Eye Hospital, the great Almond Street Hospital is associated with us, the Institute of Neurology. So when we talk medicine, healthcare, health in general, UCL is an amazing place. And so the Global Business School of Health made a lot of sense to establish at our state-of-the-art campus in East London, which is UCL East, which is on the Queen Elizabeth Olympic Park, and to offer a program really designed for health care and health professionals here in the UK. So I'm going to talk mainly today about this executive MBA, but we've got an in-person MBA that we also offer along with MSc programs. And the idea behind the Global Business School for Health is really that healthcare today faces a number of challenges, as we all know. Population growth is waning, but aging is a major contributor to our healthcare demand and constraints. So, and particularly in Europe, we see aging populations. Many of them, people are living longer, but they're not necessarily living healthier lives. And so the kind of demand on the health system is tremendous. We also recognize climate change, lifestyle changes, non-communicable diseases. So all that conflates for a lot of demand. And yet on the supply side, we've continued to do things relatively the same as we have, for about 100 years, from the real establishment of a hospital model where hospitals are the center and the place where we go. And so our health system has historically really focused on therapeutics as well. And so the idea behind the Global Business School for Health is to take a different perspective, to use a business and management lens to think about some of the challenges we face, but also to be really interdisciplinary. So our faculty at the Global Business School for Health is quite diverse. It's very interdisciplinary. We have people from social science backgrounds, business school backgrounds, public health backgrounds, clinical backgrounds, all coming together, really focusing on a number of challenges, particularly in terms of thinking about health systems, thinking about health management, and the digitalization of healthcare, the patient-centered healthcare, as well as looking at issues around finance and operations of healthcare systems. So it's a wonderful and dynamic place with world-leading experts to really take forward this mission of engaging both in terms of health and healthcare management, research and education, but to really provide a difference in improving healthcare outcomes by really innovation within healthcare systems. So we do that. We've got a number of postgraduate programs which help to form a very dynamic and exciting postgraduate community, so that our postgraduates are really well looked after, engaged, to address all these strains on the health system that we just discussed. So how does the Senior Leader Health Apprenticeship sit into that? Well, as a school, we are trying to develop programs and scholarships and opportunities to widen that group of people. We take people from the public sector, the private sector, from all sorts of different aspects, because it's a health ecosystem that we need to focus on. And that health ecosystem has changed tremendously, particularly since COVID. And so we want to be dynamic, not just in terms of the topics that we teach, but also in terms of our student body, and making sure that we're capturing those people who are in the health system, and particularly here in the UK. So I'm so excited about this Senior Leader Health Apprenticeship, because I believe that it offers an opportunity for many of those health professionals who want to come in and get the education that's offered at the Global Business School for Health, but also allow them to do that and stay in work and apply what they're learning in real time, and also tap into the Apprenticeship Levy funding. So first of all, what are apprenticeships? So apprenticeships have been around now for several years. Employers of a certain size, large organizations, they pay into what's called an apprenticeship levy. It's money, it's almost like a tax, an employer tax, payroll tax that they pay. And that money then sits in a pot, and they can access that pot by using it for learning and development. The NHS puts a lot of money into the apprenticeship pot, as it were, and then trusts use that money and that levy funding and other health organizations and healthcare more generally, but public health as well, to help train and upskill their workforce. So then employers with universities and other organizations have created what we call apprenticeship standards. So what I like about the apprenticeship, because it really reflects the way that we have designed our programs at the Global Business School for Health, it's very much professional career programs that help give people those competencies they need to complement and support the evolving healthcare workforce. So this particular apprenticeship, it's called Senior Leader Apprenticeship. What we've done is we've adapted that. We've made sure that we hit all the standards within the apprenticeship. And then we have contextualized it in health and healthcare. So it's a level 7 apprenticeship, which is equated to a master's level. And of course, it's a nationally recognized qualification. And those people who come on the program need to be sponsored by their employer, because their employer will then tap into these apprentice levy funds to pay for that apprenticeship portion of their program. Moreover, it's designed for people who are in work, so you would be expected to continue in your role in your workplace. So that's quite exciting, because it allows you the opportunity then to take your learning and continually apply it into your workplace. And it's really just structured to develop leaders, managers at the master's level. So if you look at the apprenticeship, you'll see that there's a comprehensive list of knowledge, skills, and behaviors. And these will be the competencies in which you will be assessed at. And they will also be embedded throughout your learning. And so we've mapped this program very closely to our executive MBA, which of course has been designed for really reaching those competencies, providing professional training for people who are at that level of experience. So it works really nicely for our executive MBA program and that alignment. So consequently, if you do this senior health apprenticeship, you can then top up is a word that's often used by taking some additional courses and learning to get an executive MBA at UCL. So why an apprenticeship then with an executive MBA? And of course, you can come on and just do the apprenticeship. If you do that, you would leave with a postgraduate diploma. But if you want to continue, you can continue on to the executive MBA. So it's a great opportunity for you to get a world-class education at a top-tier business education at a leading university, one that's known for really excellence in everything that it does, and in both terms of research and education. It will help develop your leadership skills, your knowledge, your behaviors, which are really essential for healthcare. And I think will continue as the NHS and healthcare, moreover, in the UK becomes more professionalized. Having this kind of cutting edge education and opportunity will be imperative. The thing about this program, it's part-time, it's mainly online, so it's designed for those individuals who are busy professionals and need to really be able to do their work, but also and take education, but also stay in the workforce. That initial 12 months really will focus on your core leadership themes. And then you'll have some additional year dedicated to enhancing your leadership qualities and academic skills. It's very comprehensive training. And of course, as I've mentioned, you get the opportunity then to continue on if you'd like and get a full executive MBA health, which will equip you with additional advanced qualifications and skills and support. The other thing is, as you're going through this program, you'll get lots of highly interactive program support, both individually and in group tutorials, to make sure that you meet all the apprenticeship competencies. And then, of course, there's also career advancement that you might look for in your organization. So each module in this program is crafted to give you the skills that you need. The way we've designed this program is that modules are integrated, because that's how the workplace is, and that's how the future of work will be offered to you. So the first module you'll take is an integrated module called Strategy, People, and Marketing. It will run over 8 weeks in the first term. Each topic will be covered in a 2-week period, and then you'll have a final 2 weeks that pulls that module together in a wrap-up. Your assessments will very much prepare you and align with the apprenticeship assessments. And when you finish that, then you'll go on, you'll have finance and economics and data. Again, extremely important. So you'll start out, you'll get those strategic skills, you'll also get some of those soft skills, then you'll move into more of those hard skills around finance, economics, and data science. Then when you come to your third term, you will do what's called the Global Health Research Project. So you get and gain research, you'll work in a team on a research project. That will really help you hone in your research, your data, your evidence-based approach to thinking about healthcare and healthcare research. You'll come back and you will get an additional module, and it's the executive leadership module. And then you'll do your final apprenticeship assessments. So essentially, it looks like this. Your first module will be in term 1. It will start at the beginning of October. We'll start at the end of September, because you'll have your onboarding. Then you'll have this first module, the apprenticeship kind of part 1, which it will run across 18 months. So you'll have that. You'll start at the kind of end of September. You'll have your induction. You'll start your module at the beginning of October. You will be online, but you will have synchronized and asynchronized. What does that mean? You'll have some sessions that'll be self-work, preparing, and then you'll have live sessions but that will be online. You'll finish off that module in term 1. In term 2, which will start around January time, you'll take finance, economics, and data. Again, it'll run over 8 weeks. There'll be assessments. Again, you'll have 2 weeks of finance, 2 weeks of economics, 2 weeks of data science, and then 2 weeks of wrapping it all up and completing your assessments. Then you'll start your term 3 in around April time. You'll have your Global Health Research Project. Again, you'll work in a team. It will run across, a kind of 8-10 week period. You will have workshops also that will help to increase and improve your research skills. Then you will come back. You'll have a break, a short break there around August time. You'll come back again in October. This time in term 1 of your second year, you're going to take the executive leadership. Again, it will be a 30 credit module. There's a lot of competencies for your apprenticeship you'll be gaining in that. As I said, you'll also have individual check-ins. You'll have group tutorials. All of that will be to prepare you then for these compulsory endpoint assessments that we will administer to you and assess you. And at that point, you will have completed your senior leader health apprenticeship. For those individuals that go on and do the executive MBA, you will then also get psychometric testing. You'll do individual coaching. You'll also have career counseling, and you'll continue on, and you'll have 3 components. One of the things that I forgot to mention here is that in March of your 18 months, you'll have what we call a deep dive into UK healthcare. It will be a 1-week, a kind of intense week. It's all face-to-face. It's here in London. And that is designed to give you a deep dive in not just into the NHS, but into this whole health ecosystem. You'll learn about pharma, biotech. You'll learn about digital health. You will visit number of site visits. It's a fantastic week. I can assure you that the students who are on our executive MBA love this face-to-face component. The other nice thing about that is it's just before you kick out into doing this global research project where you're going to work as a team. So getting to meet your colleagues and having that 1-week face-to-face residential is really important. Now, if you go on to part 2 will be 6 months. It will give you all the credits then that you need to get that executive MBA. You'll have 2 very core modules. The first one is contemporary topics in healthcare. Those will be cutting edge topics, things like digital transformation, change management in healthcare, and you will other topics as well. And you will do those over a 4-week period, 8-week period, sorry. And that will, and then you will have your assessments on those. And then you will also come back again in term 3 to have a health consultancy. So you'll work with a company, an organization, and you will learn what it's like to consult. You'll have a project. You may do that individually, or you may do that with other people on your program, depending on the size of the project. Those are all real world projects. You will work with organizations here in the UK, and you will work on a project that they have designed for you, and you'll also be assessed on that. The other thing that you'll get in that last part is you'll now have an opportunity to do a deep dive, but not in the UK health system. It will be globally. Next year, we're taking our first cohort of executive MBA students to the San Francisco Bay Area to learn about the US health system, but moreover, to learn about technology and innovation in healthcare. They'll be visiting Stanford, they'll be Silicon Valley, they'll be visiting the largest integrated health service, Kaiser Permanente, to learn all about the various aspects of health and healthcare in this dynamic area of San Francisco. That's, again, a 1-week residential program that the students go on as part of the program. And then once they've completed all that and their journey there, they will graduate with an executive MBA from UCL. So what makes all of this stand out? Well, look, we are, as I said, not just the first business school in the world for health and healthcare, but health and healthcare is in our DNA. So you'll do a lot of case studies. You're going to also have the opportunity to do simulations. One of my favorite simulations is called Healthcare Heroes. It's an opportunity for you to run a hospital for a couple years. You'll be put in teams with your colleagues. You will have opportunities to come up with the leadership structure, the strategy, the mission of the hospital, and then you will have to make all the financial decisions that would go with running that hospital. You'll get quarterly reports. It's a dynamic game, so you may have to deal with a pandemic. You will have opportunities to purchase another hospital that may be failing. So you'll learn how to manage beds, infection control, waste disposal, your human capital, of course, the kinds of specializations in the hospital. It is a comprehensive opportunity for you to learn about how to run a healthcare system. We also have other simulations, role plays. You will also have case studies. All of this will be contextualized in this larger, broader definition of our health ecosystem. So everything you would do. So if you were to go on just a general MBA, of course, it would not be contextualized in health and healthcare. The academics that will teach you will all be undertaking research in one of these spaces. It will run cross prevention, diagnostics, therapeutics, and then really looking to the future of what we can expect going forward. We also have an amazing program called Health Executives in Residence. It's an opportunity for you to network with CEOs, former CEOs, health leaders in general, who will mentor you. You'll be assigned a mentor. Also, you'll have opportunities to hear some of these people come in as speakers into your modules. And we also work with recruitment agencies. We put together a talent book. We'll be giving you, as I said, psychometric tests to help you get a personal development plan, to think about your expectations of the program. And then, of course, also, you'll have access to executive education programs going forward, because no one can work in healthcare today who's not a lifelong learner. And so you're going to have lots of opportunities. We have a wonderful evolving executive education programs that we're offering all across the world, both in customized and open programs that you'll have opportunity to be a part of. And then, of course, you'll be a UCL graduate. So those networks, those connections, and those, I assure you, not just the colleagues you meet on your program, but within the institution will last you a lifetime. So who are we looking for? Who are the people that we expect to go on this program? Well, given that we're already running our executive MBA, we've got a good idea. We're looking for people who are mid-career. You need to have at least 5 years of work experience to come onto this program. And you'll appreciate how empowering that is, because it gives you lots of opportunities to have peer-to-peer learning, to hear from other people on the program. Ideally, you'll have either good academic or clinical background with work experience. You, of course, need to be in training and work while you're undertaking this program, and you'll need the support of your employer. People come on this program, they're ambitious, they're determined. They're looking to build out their careers either in healthcare management, pharma, biotech, consulting. Many people who do an MBA do it because they want to accelerate their career. They're not just looking for a step up, they're looking for a jump up. So it's gaining those networks. We've got nurses on this program. We've got consultants on this program. We've got people from pharma on this program. So it does appeal to a wide, diverse group of people. So that definitely public health. The definition of the kind of professionals on here is quite wide, but everybody shares that passion for meeting and delivering on the health challenges. There's also going to be lots of career support. As I said, some people will be more interested. Maybe they come out of consulting. Maybe they're going to want to go into consulting. People looking for senior management roles in the NHS. But of course, as I mentioned, pharma, biotech, public health, private health space, insurance, it's really open to a wide variety of individuals, companies. Of course, health tech and technology is becoming bigger, and startups and smaller organizations can also tap into the levy funding. And I'm going to highlight a way in which they can do that. So the kinds of careers that people have out of such programs is quite open and wide. Now, in terms of the fees and funding, we have already discounted this program in relationship to our executive MBA. So the total would be $30,000 if you continue on to do the executive MBA. If you just want to do the senior leader apprenticeship, you can use the levy funding, and that part of the program, that part one, is £14,000. And as I said, that can be and needs to be funded through the apprenticeship levy. If you want to go on and get the full executive MBA degree, it will cost you an additional $16,000 that can be paid over 2 years in actually 6 installments. The way UCL does payments is it's in 3 payments per year. And then, of course, like I said, you need to be working in employment with an eligible organization that can fund part one, and tap into the apprenticeship levy. For the non-levy part, or doing the executive MBA, the other 16 grand, that can either be funded by your employer, it can be funded by you, or it can be funded by a scholarship or other funding. There's also opportunities for those who don't pay into the funding. This is for employers, our smaller NHS organizations such as GP surgeries. They can also access this funding. So I highly recommend, if you're a GP or GP surgery and you'd like to bring people onto this, go to non-levy employer apprenticeship funding, and you can find out, more about how you can tap into this money. We're very excited about this program. We believe in it very wholeheartedly. Of course, there's part 2, and that's the UCL EMBA. Of course, if you're not a part of the levy funding and you just want to come and do our executive MBA, you can apply to that. So for those who can't go down the apprenticeship pathway and you're a home student, you can still come on to the MBA. You would start in September, you'd have the 24-month MBA, you'd go through everything that I mentioned, and that is, tuition for that is $45,000. There are scholarships available that you can apply to. So the route onto the executive MBA is multiple. And for overseas students or non-levy students, you can go down the route of just applying for the executive MBA. I want to just talk a little more about your projects, because I think they're quite exciting and they are highly impactful in terms of the skill set you get and the opportunity. So first, I want to talk about the Global Health Research Project. Again, as I mentioned, it will follow your first residential, which is your deep dive into the UK. You'll get to know your colleagues really well. And this is designed for you to work in small groups. You'll work with your peers to identify areas of need for health improvements. You'll get a health idea or innovation. You will do a mainly desk-based research project, but you've got other opportunities to build this in any way that you want. It's about creating an original piece of research, building around the various strengths of your colleagues and the people in your group. The aim of the project is really for you to gain those essential research skills, things as, critical appraisal of articles, research design, planning, data collection, analysis, and presentation skills. Its appropriate use, in particular in business and leadership in healthcare, will be imperative. And then there's also this consultancy project, which again is a fabulous opportunity. This can be independent or in a small work, depending on the project and the company or organization that you're going to work with. They will have provided us with a problem or opportunity that needs addressing. They'll be health clients. You'll work with them just like you were a consultant. You'll also work with the career coach to find a good fit for your career ambitions in terms of thinking about your consultancy and who you work with. And the aim of this project is really to give you an in-depth knowledge of how to undertake effective consultancy work. Again, it'll give you another opportunity, another bite at really, honing in your research skills, your knowledge skills, your project management skills, so that you can go on either within your organization or in another capacity. So lastly, one of the final things I want to mention is, so what does it take to get onto with this program? First, you need to have a UK minimum of an upper class second, 2-1 or above. If you're overseas or you haven't taken a degree in an English-speaking country, you would need to have a level 7 or above on your IELTS test. We're looking for people, especially on the executive MBA, with 5 years minimum work experience. All candidates who meet the entry requirement will get an interview, and then you'll write a personal statement and you'll have 2 references. And of course, for the apprenticeship, you will need to make sure that you've got GCSEs of a C or above in math and English. As I mentioned, if you're not coming through the levy, we do have scholarships. We've got scholarships we offer through the Global Business School for Health. There's also scholarships through UCL. If you're an overseas student, there may be opportunities to get a Chevening, a Commonwealth. There's also US federal loans. And then, as I mentioned, there's going to be lots of career support that starts really from the onboarding point on. Either be opportunity to take some online self-paced primer courses to help you build up your skill set. There's also going to be your induction, your psychometric questions, personal tutoring, one-on-one coaching. So this is really about you. It's a real investment in you to make a difference. And then, of course, most of the time, students that do these programs are really busy. But there is also lots of opportunities if you want to volunteer, join a club, join a society. We also have excellent student support and well-being. So if you have any mental health issues or, need well-being, want to talk to a counselor, need advice, we've got you. And then if you're not from London, you will have the opportunity to do the study week in London. It's fabulous. I can't even tell you how raving the reviews from our students were. And it's not just about visiting healthcare organizations, it's about the camaraderie, the bonding that you'll do. And then, of course, that second year. And as I mentioned, our students this year, this coming year, will go to the US, they'll go to San Francisco, but some years we'll have other international locations. So it will vary from year to year. So that's really my presentation. Really appreciate your engagement, your patience. If you want an informal chat about the program, you'll see my colleague's email address, nicola.cochgerton@uclac.uk. So I'm going to stop sharing my slides and I'm going to move to the chat and hopefully there's some questions that we can take forward. So good question. How many hours per week will we be needed to invest in? I think you can anticipate to need about 6 hours a week approximately. Sounds about right to me, to keep up, to go through the online materials, and then of course you're going to have your face-to-face sessions. If we do not have capacity to start the program this year, will you be running the program next year? Absolutely. So, this will come around again. So if you can't get on this year, do keep us in mind for next year. How many people are typically enrolled into the program? We're anticipating taking around 20 onto the senior leader apprenticeship. We have some capacity because most of it is online, but and then there'll be about 20 or so who've also come through the executive MBA route. So you should think about around 40 it will be in your cohort as a maximum. Is already concluded the boot camp is not overlapping. Just wondering if I have to wait 1 year because of the data boot camp you have the requirement to not having been founded for any other boot camp or educational program for the previous year. No, actually, we are recruiting for 24-25 right now. So you don't have to have done any kind of boot camp. When you come on this program, you'll get an extended onboarding induction. And as I said, what we'll do is we will send you these primer courses that you can work through online to just help even the playing field before you start the program. Roughly how many hours per week? We've been through that. And we answered all the other questions. So is there any other questions? If I am working on a working visa, I'm working for UCL already, am I able to apply for the apprenticeship? So UCL would be your employer. So you would need to find out whether or not they would fund you and that arrangement. So I don't know how that works. I don't know what kind of visa you have. But what I would suggest that you do is that you talk to the UCL HR and find out you know what the situation is. Okay, anyone else? How many people taking the executive MBA or apprenticeship progress into VP C-suite roles? Fantastic question. I can't tell you right now because we're just with our first cohort. As I said, we're a very new school. So but I have to tell you, our executive MBA group in our first cohort is an amazing group of individuals. So I have no doubt that they're going to go on and do amazing and exceptional things. But it is a 2-year part-time program. So we won't know till the end of next year exactly where they land. But I think it's about you and how you're crafting your career and how you see this program fitting into that. So no one program, by the way, will get you into the C-suite. It's about that accumulation of experiences. And that's where the career coaching comes in so important as you go through your program, because that will help you make sure that if that is your aspiration, you are lining yourself up to achieve that. All right, any other questions? Okay, well, look, you have been an amazing, engaging audience. I've really enjoyed speaking to you. Again, Nicola Cockerton would be very happy to set up meetings. If you need more information, we can set up meetings with the academics. If you're not sure how to do the application, again, Nicola can give you that support and advice. You know, I think the next step, if you're not an employer, is to talk to your employer and find out more. So is there career support for the senior leadership health? There is. It's not quite at the same level. It's much more about mentoring and supporting you with your assessments. But of course, you're coming in, you're part of the cohort. So you'll get that first part of the journey. However, those that go on to the executive MBA will get a much more substantive piece as part of that last 6 months of the journey as they prepare to go out into the labor force. But yes, you will get everything along the way. We want you to be terribly successful. Okay, thank you again. Thank you so much for your time. Up, one more last question. Thank you. You're welcome. Again, if you need any support, any other questions come to mind, please do not hesitate to reach out to myself or Nicola. Have a great evening and take care. Bye.